Early use in prevention is what we call adolescents who are using substances before the legal age, with the greatest risk for addiction occurring when kids are using substances before the ages of 14 and 15. When we're talking about early use drugs, what we call early initiation drugs, what we're talking about is alcohol, tobacco, marijuana, vaping, and inhalants. And so it's just really important that we focus on these drugs when we're really talking to our kids and trying to avoid early use. The research really tells us that kids that start using or experimenting with substances in adolescence are actually 4 times greater chance of developing addiction at some point in their lifetime. It can also lead to mental health symptoms. It can lead to low social skills, poor performance in schools, lower self-esteem, and so it's really vital that we are really encouraging kids to make better decisions because of these risk factors. Parents and caregivers have tremendous influence on early use. Surveys are done both in our local school districts and nationally, and it tells us time and again that parents have more influence on kids' decisions about early use than we think that we do. So it's important that you have those conversations. We know that sometimes when we're talking to adolescents, they don't seem engaged in the conversation, they don't really want to be there, but we know this, they hear you. And so it's important to have the conversation and to make sure that they are clear on your position on early drug and alcohol use. I can tell you that I am the parent of 2 teenagers. I have been working with folks with mental illness and substance abuse disorders for 25 years. Now with Compass Mark, helping to implement programs in the schools to help with addiction prevention. Being a mom of 2 teenagers, I decided very recently to go back and just make sure that we were on the same page. And what I found is that in fact I had not been clear with my kids about how dangerous it is to use substances early and how important it was for them to wait to the legal age to use legal substances. So even with my experience and my work that I do, I hadn't been talking often as well as talking early. And so we just need to, as parents, understand how important our influence is and have those conversations.